I would like to introduce Mr. Tarun Panda, who is a Therapeutic Software Private Limited. The topic is super changing the mental health economy ecosystem in the India.
Organizing this wonderful event and giving me and my organization an opportunity to talk to you all. Just to give you a brief background, I represent a company called Therapy Software. We are a 10, 12-year-old company. We started our operations in the US first, and then we came into India in 2017. Our focus has been to enable the mental health practitioners to offer better solutions and to do better management of the practices. So initially we started out with just a directory services called psychologyindia.com, and then we launched the practice management platform also. So just to give you a brief insight about what we are planning to do, like what we have heard from all the other speakers earlier on, is there's a tremendous amount of effort going on in the country and also globally in trying to address this issue. The principal issue that we have seen in India is the huge disparity between the number of patients and the number of service providers. I think the ratio is crazy, like it's in excess of 1:10,000 or something like that. So obviously there are multiple challenges there, and let me take you through our game plan and then we can discuss and answer all your questions as we go to the next slide. This particular slide talks about what is the potential problem that we have seen over the last 3-4 years of our engagement in the market, and how does it affect the society at large. Here we have taken only a small aspect of it, one corporate organization, which is a small mid-sized company, and this is based on live data. And if this is happening in a small mid-sized company, imagine the plight of larger organizations and the society at large. Obviously, this cannot be solved by a single organization or a small group of people. We need to build an ecosystem to address this. And I believe, or we all in our organization believe, that there are 4 essential building blocks. The first building block is the professionals who are actually engaged with the patient community and trying to help them out. The second and very important building block is the researchers and the educationists who are working in this space. Typically, people who are facilitating the education process in terms of the college education and the various researchers working either in medical facilities or within the education ecosystem. And the third building block, which we think is important, which has been there in bits and pieces, Dr. Roshan Lal did mention about a centralized nodal agency to manage and build the whole thing. We also are in agreement with that. There has to be a central regulatory body. Even though we have seen organizations like RCI trying to do some work, but they're too defocused at this point of time. Mental health is important, but not very important for them. So we need somebody focused on mental health and specifically on the group of psychologists who are trying to address the problems. With that respect in mind, we created the directory called psychologyindia.com. Response has been extremely good. We have added about 3,500 to 4,000 members already signed up in the last couple of years. And we're getting about 30-40 signups every week in that directory. It's free to register, free to use. And of late, we have also started seeing the patients looking for practitioners in this directory and contacting them directly. They do come back to us and ask for assistance in connecting them. We do that. But we're trying to build more solutions to be able to make that connection as friction-free as possible. Having said that, this is what we think each one of the groups will end up doing. And you, as I said earlier on, the first group, which was the professionals, they're actually seriously engaged with the patient engagement part of the ecosystem. Then we have the knowledge-based creators. The university faculty members or the people who are doing research, they are actually creating the knowledge base which are relevant and pertinent to our country. I personally feel that we need to do that because imposing of Western thoughts and Western processes on our problems will not create the solution that we're looking for. While all this is happening, we still need to take care of our patients. And we aim to build a bridge between these two entities as we go forward. And we're also looking to help build the regulatory body or the regulatory system or contribute in whatever way we can. And whenever that happens, we would like to be a part of that to facilitate that process to make it as soon as possible. As I said, the directory is already in place. You can go and visit that and go ahead and register and add your professional profiles. There is a special category for researchers and a special category for educationists who are working in the mental health space in India. So you can do that and add your profiles there too. That's completely free to use. We have given the links here. It's a simple thing, psychologyindia.com. And then the other site, we also have a completely online practice management platform. So one of the speakers did mention about the proliferation of online counseling platforms. We also offer those services. For non-commercial usage, we have a very good, low, accessible price for research purposes. For commercial usage, we have the normal market rates, which can be shared whenever at the right point of time. So this is the basic crux of our discussion that we wanted to do today. We are at the end of a long day today. I did not want to bore you or drudge you people with too much of information. So coming back to the last but one slide in my discussion of the presentation, I think we need to go forward and divide the problem to actually conquer. And we are already working in a disparate and relatively uncoordinated way. We need to bring some cohesion into our efforts to make sure that all of us working in the right direction. We are also willing to put in the systems to be able to share information between or across the stakeholders to be able to highlight successes and learnings that come through. And we're also willing to share the credits and financial gains, if any, based on the contribution in creating this ecosystem. So that's about it. I'm open to any questions and any more suggestions from your side. Over to the group.
Thank you so much, sir, for enlightening us about this mental health ecosystem in India. And we will keep these points always in mind. Thank you so much, sir.
Thank you. Thank you very much.
Thank you so much, sir. So